Hello, and thank you for joining us for the sixth annual Global Summit on Kidney Disease Innovations, Vox Populi. The time is now to prevent and cure kidney diseases. This summit is hosted by the American Association of Kidney Patients in partnership with our allies from the George Washington University School of Medicine and Health Sciences. My name is Edward Hickey, and I have the honor of serving as president of the American Association of Kidney Patients. I'm an attorney from California, and I'm a chronic kidney disease patient and have experience as a care partner due to the history of kidney disease within my family. Early detection and timely innovation are pivotal to managing kidney diseases, which affect 850 million individuals worldwide. The adoption and implementation of early screening recommendations and protocols is a strategic priority for AAKP and the global kidney community. The fact is that early screening and early intervention limits the burden of kidney disease on people, family, taxpayers, and health systems. AAKP has spent years advocating in the United States for a federal government recommendation to screen early for kidney disease. Right now, the U.S. Preventive Services Task Force is still debating whether there is enough evidence to support such a recommendation. As patient advocates, we believe the evidence already exists, and you can find it among the millions of Americans whose lives and livelihood have been disrupted by a late diagnosis of kidney disease. Evidence is also found among the millions of families who have lost a loved one to this devastating disease that could have been prevented or better treated. We believe the failure to adopt a national screening recommendation is a negative government determinant of health that must and will be reversed through advocacy. But outside of government, there's an overwhelmingly positive news. Innovation is driving a new generation of highly sophisticated diagnostics and medical practices that result in earlier disease detection. Today, we will hear about some of these new technologies and share valuable insights on how advancements in early screening techniques and care practices will transform patient care. We will explore the latest research findings, practical applications, and the impact of these approaches on patient care and patient lives. With that, I'm honored to serve as the moderator for our session entitled Utilization of Early Screening and Enhanced Standards to Support Early Identification and Intervention of Kidney Diseases. Finally, we are joined by our very special guest, Dr. Ashley Beasley Green, the project lead for urine albumin standardization and the lead member of the Biomolecular Measurement Division at the Material Measurement Laboratory of the National Institutes of Standards and Technology, also known as NIST. Dr. Green's work at NIST focuses on urine albumin standardization, which plays a pivotal role in the early detection and monitoring of kidney diseases. Her expertise in developing and implementing enhanced standards ensures the accuracy and reliability of diagnostic tests, thereby improving patient outcomes and enabling timely interventions. Today, Dr. Green will be sharing her insights into her recently published research. Dr. Ashley Beasley Green, take it away.
Good morning. Thank you so very much, Mr. Ed Hickey, for that wonderful introduction. Thank you to the American Association of Kidney Patients, AAKP, and George Washington University for inviting me to participate in this wonderful summit. I'm excited to be here and give you a little bit of information about NIST activities in the area of kidney disease research. The title of my presentation today is Innovation in Kidney Disease, from Bench to Bedside. The goal of my talk will be to show the influence of scientific research conducted at the bench on the quality of patient care performed at the bedside. I am the leader of the NIST Urine Albumin Standardization Program, and the goal of this program is to establish the foundational pieces of a framework that will support patient results for kidney disease. Before jumping into the science, I want to provide a brief overview of NIST. The National Bureau of Standards was established by Congress in 1901. The name was then changed in 1988 to the National Institute of Standards and Technology, or NIST. NIST is a non-regulatory agency within the U.S. Department of Commerce, and NIST functions as the National Metrology Institute, or NMI, for the United States. NIST measurement science provides the foundation for innovation in every industry and economic sector, from manufacturing to healthcare. We're involved in the smallest technologies to the largest and most complex of human-made creations, from nanoscale devices to earthquake-resistant skyscrapers and global communication networks. The mission of NIST is to promote U.S. innovation and industrial competitiveness by advancing measurement science, standards, and technologies in ways that enhance economic security and improve our quality of life in the U.S. and beyond. NIST accomplishes this mission through research programs, standards work, user facilities, and innovation and industry services. Here are a list of some of the key priorities NIST is focused on: cybersecurity, bioeconomy, quantum science, infrastructure resilience, advanced manufacturing, artificial intelligence, and the Internet of Things. My research focuses on the bioeconomy priority, and the connection to the mission is to improve the quality of life for U.S. citizens and also beyond. The bioeconomy encompasses economic activity resulting from biology-based products and processes. NIST develops tools such as measurement science, data, standards that support and enhance innovations in biotechnologies to bridge the gap between research and market realization. Specifically for this presentation, I will present how the measurements, calibrations, and standards developed at NIST support the accuracy and efficacy of medical therapies and test procedures. So NIST is involved in kidney disease, and I just kind of want to give a little bit of background about the impacts of kidney disease on public health and the economy. As you know, the kidneys filter blood to remove excess fluids, salts, and waste products. Loss of function in the kidneys, either short-term or long-term, can be life-threatening. Kidney disease poses large economic and public health issues. For public health, it's ranked the top 10 leading cause of death among U.S. adults. The prevalence of chronic kidney disease, or CKD, among U.S. adults is approximately 15%, which is more than 1 in 7 adults being diagnosed with CKD, and this data is from 2019. In addition to the public health impacts, there's a huge economic burden of kidney disease on the U.S. economy, with Medicare costs rising above $80 billion. Clinical testing for kidney disease rose in 2020 to 35.4%, and millions are spent annually on blood and urine tests for kidney disease. The impact of kidney disease on public health, combined with the large economic burden for the U.S. and beyond, is the reason NIST is involved in a global effort to support the accuracy and efficacy of clinical tests for kidney disease. This graphic illustrates the connection between research conducted at the bench to the quality of patient care performed at the bedside. A clinical question or preventive care prompts the need for a clinical diagnostic test. The results of the clinical test lead to a medical decision by healthcare practitioners. These medical decisions lead to medical actions for the patient, such as drug therapy or a surgical procedure. Patient care decisions made by healthcare practitioners for disease diagnoses and management are influenced greatly by the validity of these clinical test results. So the quality of these results is essential for patient care. The quality of clinical results impact clinical guidelines. These guidelines lead to decision points made by the healthcare practitioners. They also can lead to healthcare costs and also changes in policy. Clinical results are used to identify the presence of or risk of disease, guide treatment decisions, monitor the success of treatment, and assess the risk of disease recurrence. Bottom line, clinical results influence medical decisions and actions. The goal is to ensure the clinical results are of the highest degree of quality and accuracy for patient care. This graphic illustrates the impact of standardized clinical results on patient care. Now, when a clinical analyte or a biomarker or marker is standardized, this means that from one specimen, the same value within an uncertainty bracket is observed, irrespective of the lab conducting the test, as you can see here, the different labs, or the specific method used for the test, as you can see here, method A or method B. What does this illustration look like from a scientific perspective? From a scientific perspective, the clinical patient result for the specific clinical marker is linked through an unbroken chain of metrological traceability to the International System of Units, or the SI, via a series of methods and materials. The International System of Units, commonly known as the metric system, is the international standard for measurement. It is the foundation of measurement. I like to think of this schematic as a boat and an anchor. The purpose of an anchor is to secure a boat to the bed of a body of water, to prevent the craft from drifting due to wind or current. This is the exact function of the SI as it relates back to the clinical patient result. See, when the clinical patient result or clinical marker is standardized, meaning there is an unbroken link between the SI unit and the result, the clinical patient result, like a boat, does not drift as a result of the laboratory, you can see here, laboratory 1 or 2, or the method used to produce the result. Now, what happens when the clinical analyte or marker is not standardized? As you can see here, if the clinical marker is not standardized, a different value outside of the uncertainty bracket, as you can see here, these values are in different colors, or these are completely different values, may be obtained for the same clinical sample using the same method or laboratory, or using a different method or laboratory. This impacts the entire spectrum of patient care, from the delivery of incorrect or inconsistent medical decisions to inflated healthcare costs, all based on the quality of the clinical patient result. From the scientific perspective, the link between the clinical patient result and the foundational SI unit is broken. Going back to the boat and anchor idea, if the clinical patient result is not anchored or connected through an unbroken chain of traceability to the SI unit, the patient result, like the boat, can drift. So you arrive at different values for the same exact specimen. The validity of clinical results impacts the quality of patient care via medical decisions and actions determined by the healthcare practitioners from these results. For high quality patient care, clinical results must be accurate, comparable, and reliable within and between both the laboratories and methods. Unfortunately, this is the current status of clinical albumin results. Albumin is a biomarker for kidney disease. It is a protein that is highly abundant in the blood. And when the kidneys are not functioning properly, you have an excretion of this particular protein in the urine. Clinical urine albumin is a major marker used in screening, diagnosis, and management of kidney disease. The standardization of urine albumin is a global effort aimed at enhancing the accuracy and reliability of clinical results for kidney disease. Better results impacts the quality of patient care. I lead, as I've spoken before, the NIST Urine Albumin Standardization Program. We collaborate with U.S. and international stakeholders to develop the higher order reference materials and method to establish an unbroken chain of traceability from the clinical patient result back to the SI unit to prevent the drift of the clinical result and to aid in high quality medical decisions and medical actions. The first in the series of materials is that NIST has developed is the NIST Standard Reference Material 2925. This is an aqueous solution of highly purified albumin protein, and it is intended for use as a calibration tool for manufacturers of clinical assays and also clinical laboratories. This material is internationally recognized by the Joint Committee for Traceability in Laboratory Medicine, or JCTLM. JCTLM is an international organization that promotes the global standardization of clinical laboratory results. Next, in this series of higher order materials and methods, we have developed a multiplexed targeted method using mass spectrometry to detect and quantify albumin protein in human urine. What is mass spec, you may ask? Mass spectrometry is an analytical chemistry tool used to measure molecules. In this case, we're measuring albumin protein in human urine. Here is a quick schematic of the process. We take albumin in human urine, digest the protein into protein fragments or peptides, and use mass spectrometry to analyze those peptides, and then do data analysis to determine the concentration of albumin in human urine specimens. Here we demonstrate that we can quantify albumin in human urine using our NIST method by comparing the results of the NIST method to that of a routine clinical method for albumin in human urine. As you can see here, NIST is the blue diamond and the results from the routine clinical method are the orange circles. You can see here for most of the concentration or samples, the concentration determined for albumin in the human urine material is consistent between the NIST method and the routine clinical method. However, there are some concentrations higher than the 100 milligram per liter mark. There are some discrepancies between the two methods. And that's really the goal here, is to ensure that we can develop a system that will standardize all measurements for human urine albumin. I want to mention that the goal, however, of the NIST method is not to be used in clinical settings for determining albumin in clinical patient samples. The goal of the NIST method is ultimately to determine the content of albumin in a human urine reference material. This is a secondary reference material. This is the key component in this traceability scheme in creating an unbroken link between the patient sample and the SI unit. We have recently released the new NIST Standard Reference Material 3666 material. This is, as I mentioned, the key in linking clinical patient results back to the SI unit. So what does that mean? That means that we can ultimately arrive through creating this link at the same value, irrespective of the method or laboratory used to analyze a specimen. The NIST SRM 3666 is a 4-level material with endogenous or non-spiked levels of albumin, creatinine, and the albumin to creatinine ratio. The endogenous levels of albumin in this material reflect the clinical ranges. As you can see here in this illustration of a traffic light, the green represents the normal level of albumin in urine. The yellow light represents a micro level, so that's above the 30 milligrams per liter to 299 milligrams per liter of albumin in human urine. And the red represents the macro albumin level. And at this particular level, patients are really experiencing dysfunction in their kidneys, if not complete loss of the function of their kidneys. And you can see here that this material contains 4 separate components. And each one of these components has a value of albumin that's consistent across the clinical levels or clinical ranges for albumin in urine. And you can see here that the color of the vial tops mimic the color of the name of the level that I've placed here on this traffic light scheme. Incorporation of this NIST SRM 3666 material into the traceability scheme will support US standardization, but also global standardization for clinical urine albumin measurements for kidney disease. Creating an unbroken chain of traceability will enhance the accuracy, comparability, and reliability of clinical urine results that influence medical decisions and actions made by healthcare practitioners. So, what does this ultimately mean for you? For me, this means that increasing the quality of clinical patient results for human urine albumin will also increase the quality of patient care delivered to each of us by healthcare practitioners. This is a great real life example of how the research conducted at the bench impacts the quality of care delivered to each and every one of us at the bedside. At this time, I would like to acknowledge my NIST colleagues listed here and our international and U.S. collaborators who have contributed to the work that I've presented today. To learn more about the NIST urine albumin standardization program, please scan the QR code here to visit the program webpage. Also, I've included my contact information as well. I hope that you have a wonderful summit.
Thank you, Dr. Green. We appreciate your presentation. I would like to get your feedback on a couple of the same questions I asked Dr. Dorshow. Dr. Green, can you tell our viewers how critical the creation of objective standards are to the advancement of innovation in diagnostics? AAKP believes this is often an underappreciated part of developing new products in the clinical care standards in kidney medicine.
Yes, so developing standards to advance innovation in clinical diagnostics is important. As I've shown in the diagram regarding the boat and the anchor, when you have the appropriate materials and standards and methods in place, you set a framework. And this framework really supports the accuracy and comparability you've seen across time, across laboratories, across methods for clinical patient results. So really what you're doing is setting the stage for a framework that supports the accuracy and comparability of medical decisions and ultimately medical actions that patients receive.
Dr. Green, can you tell us how the voices of patients, especially the unmet care needs of underserved people, helps inform the sense of urgency in science and standards development?
I think the voice of patients, and that's all patients, from the smallest patient to the largest patient, is very important. Self-advocacy is vital in you receiving high quality health care. So we can lay the framework, we can establish the materials and methods, we can develop the technologies, the innovations. Medical healthcare practitioners can make the medical decisions and the for medical actions. But ultimately, you and I are responsible for our health. And so therefore, we must be informed with how we can ask questions. We can read the printout of our lab results because it's important to see those numbers if they change or don't change, to really be our own voice and support the healthcare practitioners in delivering quality patient care. So it's very important for the voices of the patients, all patients, to be heard, and also the education of patients in their own health is important.
Dr. Green, as a career U.S. government civil servant, can you tell us what it is like to lead key advancements in bioscience and analytical chemistry, knowing that your work will ultimately save more lives of the fellow citizens you serve? How does that make you feel as a public servant and scientific professional?
It really makes me feel as if what I do has a purpose. I've been with NIST, the federal government, for almost, well, this month, 15 years. And it's been my goal to really serve and utilize my gifts and talents as a scientist in order to support and serve the citizens of the US and also beyond. Because as our mission states, we aim to improve the quality of life, not just for US citizens, which is important, but also for beyond, because we're all ultimately citizens of the world. So I think it's very important that I get a chance to utilize all of my gifts and talents as a scientist to support the mission of NIST, the mission of the federal government, and ultimately to support patient care for all patients.
Thank you, Dr. Green. We appreciate your insights and your participation in the Global Summit.